All right, everybody, welcome to our weekly session and show. If you've been dealing with anxiety for a long period of time and you've been trying different forms of therapy and you feel like you've been not getting very far, this is definitely going to be applicable to you. If you're new to our community, please, be welcomed, feel welcome. My name is Ty Hicks, founder of mentalhealthcoaching.com. We put this content together for you guys because nobody deserves to live with lifelong anxiety. And we truly believe at Mental Health Coaching that you can live a life without anxiety if you are committed to learning and applying the right skills and disciplines. And so today what we're going to be doing is helping those of you who have been struggling with anxiety for a long period of time, but you've had a really tough time feeling like you're getting satisfactory results with traditional therapy. There are kind of 10 reasons why this might be occurring. And really, our intent through this training today is either number one, to help you get better results with your therapist that you're working with currently. Number two, to get clear on whether therapy is a valuable part of your overall mental health toolbox and your mental health journey, but maybe it's just not going to be sufficient and you might need something in addition to that. And then third, to help you no longer feel what you might be feeling, which is a sense of guilt or a sense of maybe kind of hopelessness that you are continuously trying to improve your anxiety through therapy and maybe it's just not gelling or working for you. So first of all, go ahead and let me know if you can hear me. Those of you joining us with us live, can you just go ahead and put yes in the comments if you can hear me, please, just so I know technically everything is working how it's supposed to. I see we've got people joining us live as we get going right now. And also what I'd love to see in the comments is let me know, has this been the case for you? What has been your history with therapy? So can you put in the comments, number one, what I'd like to know is, are you in therapy currently and or have you used it in the past? Number two, how much therapy have you done? How many months or weeks or years or even decades have you done? And then also, what kind of therapy have you tried? CBT, DBT, EMDR, things of that nature, because we can help you understand why maybe you haven't gotten as far as you wanted to with these different areas. So real quick, before I get into my list of 10, my sort of 10-point checklist to help you get the best results from your therapy as possible, or to, better understand why therapy is just not working well for you, I want to give a little bit of background on this. So for me, my anxiety was incredibly high about a little over 10 years ago. Substantially over 10 years ago, I guess. It was about 15 years ago. I was in my teens. Anxiety was really high, and then as a result, I was dealing with very severe depression, and it got even to the point where I was feeling suicidal. I had a plan to take my life. It was interrupted last minute by a family member, thankfully. And then I was hospitalized, and that's where I really got thrown kind of into the traditional mental health industry. I was basically put into therapy, and I really wanted to get better, and I did therapy for about 2 years. And I was on medication for a substantial period of time. I forget the exact specifics. I was hospitalized for about 2 weeks. And so, all of the kind of traditional things a lot of you guys have done or tried or are doing right now are the things that I did too. And the thing that caused me to go the mental health coaching route and kind of create mental health coaching and create something brand new that the world had never really seen was because I just didn't really get satisfactory results through the traditional means. My therapist was an incredibly excellent man, a nice man. He cared about me. I have nothing but good things to say about him. And honestly, I would say that, he was helpful to me in certain ways. He was helpful kind of as a role model and as a way to, basically as just a nice, compassionate person in my life where I felt like there was no one kind of listening to me at that time. So there were definitely some things that were valuable from the experience. But in terms of really dealing with the anxiety and the depression, the experience of therapy just wasn't really quite cutting it for me. And when I got into my late 20s, I basically kind of figured out, like, hey, I figured out my own way to overcome anxiety and depression that was independent of therapy. And I had been, depression and anxiety free for a long period of time. And then I started to realize, like, hey, there's lots of people who are still dealing with anxiety and depression, even though they're on medication or they have been on medication for a long time in the past. And they have, tried therapy for a long period of time too. So I'll probably do another separate training on medication specifically. But really, we want to tackle the therapy thing because I know a lot of you guys are trying your damnedest to really get your anxiety under control. And you're doing what you think you're supposed to do. And honestly, in a sense, you are doing what you're supposed to do. Like, I have nothing against somebody, trying therapy first. If you've never done it, like, yeah, give it a good shot, give it a try. It can be incredibly helpful for a lot of people. And there is a second group of people that get almost no results with it. And then there's a very, very large group of people in the middle that get some results with it, but not a huge satisfactory amount of results. And so I'd love to hear, which one of those do you feel like you are in? Are you the type of person that's gotten great results with therapy? Let me know in the comments. No results at all, or some results, but just not as much as you'd like. I see some comments in here, by the way. Stephanie says, a little bit of therapy in the past, but mostly overcame by the grace of God. He is literally my best therapist and has taught me many things as a therapist would. Okay, that's a very interesting perspective. My method is not religious, but that's great if that's working for you. Jones says, I have a few good things to say about my time with therapy, but they did help me to a point and keep an eye on me when I was really bad and high risk. Great. Yeah, and so, let me just kind of dispel a couple myths right out of the gate. I want to be very, very clear. I think it is very dangerous to deal in universal thinking, like, therapy is bad or therapists are bad. So let me just be very clear. That is not what I believe. I have plenty of people in my network that I consider colleagues and friends and acquaintances that are therapists. There are plenty of people I have incredibly high regard for. And honestly, if there are any therapists listening, I want to be very clear. Like, I respect you. Any person who's going to dedicate their career to really trying to help other people with mental health issues, like, fantastic. Like, that's awesome. I love that you're doing that. And by the way, there are therapists out there that are incredibly effective, but it's not as simple as, if you've got anxiety, go to therapy and the therapy will get the anxiety dealt with. What I've learned over the years is there are some situations where therapy will work really, really well. Other situations where it's going to work almost not at all, even though the therapist really wants it to work and the patient really wants it to work. And then there's a lot of situations where it is valuable but not sufficient. Okay, and it is very important for you to help get clarity on which of those camps it is, because I literally just got off the phone with somebody a minute ago, and I was doing a consultation with her, and she was basically on the consultation because she was trying to figure out, like, hey, Ty, can you help me? But what I advised her to do is I said, you know what, I actually think therapy might be the better route for you in this particular case, and so I advised her to find a new therapist. And there are specific reasons why I told her that. There are also times where I consult with people, and, they've been in therapy for, say, 5 or 10 years, and, through a series of questions that I ask them and I get answers to, which I'll help illuminate for you on tonight's training, it becomes very clear that the therapy is just not going to cut it, right? It doesn't mean they have to stop doing it. It's just that it's not going to cut it. And there are also a very, very small percentage of situations where the therapy is, believe it or not, actually making things worse. And so, I'm not here to say all therapists are bad. I'm not anti-therapist. I'm not even anti-therapy. What I am pro is anything that gets you to your ultimate mental health goals. And the real group of people, the 80% of people I'm talking to tonight, by the way, are the people who, like, you're getting value through therapy. Maybe you don't want to quit your therapy, because you like the person and you've gotten value from them in the past and they've been really nice to you and they're kind of, they're there for you and they care about you. But the therapy, you're kind of hitting a ceiling, you're hitting a little bit of a brick wall. You're hitting a little bit of a barrier in terms of your ability to get much further. So let me know, guys. I want to hear what your situation is in the comments. Let me know. And also any questions, of course, I'll answer at the very end. So to kind of reward you guys who are showing up live with us, okay? So without further ado, let's dig into this and let's go through all the little nuances. I'm going to cover as many as I possibly can and really just try to advise you and help you get clear on if you need to make a shift in your mental health journey and give you a different perspective on that. So these are the 10 reasons why your therapy sessions may not be reducing your anxiety at the level that you want to. So the very first reason is that therapists are trained that anxiety is permanent. Okay, so this is a little bit of a generalization, but not really. Okay, so therapists are trained in what I would call the medical model or the pathological model. What that means is that if you're feeling some anxiety, you go into the therapist's office, you tell them what you're feeling, what you're dealing with, and the way that a therapist is trained is that it's almost like their brain can't help it. They are going to, in the vast majority of cases, they're going to want to provide a diagnosis: generalized anxiety disorder, social anxiety, OCD. They may tell you just have ADHD. They may tell you it's a variety of things. They may say you have PTSD or CPTSD, like anxiety caused by trauma, right? All of the alphabet soup. But that's because that's how they're trained. They're trained in the DSM, right, which is this giant big book of all these different diagnoses. And they're trained on prescriptive criteria. So how to look at a person's situation, match that up to a diagnosis. And then once the diagnosis is made, they then are going to do one of two things or both. They then are going to basically consult their training and say, okay, well, what is the way to deal with this? And that's usually going to be a combination of medication. So a lot of them are going to push you to get on medication, to stick with medication, to keep after the medication. And or they are then going to, basically prescribe ongoing talk therapy. Now, there are different variations and styles. We'll get into some of that a little bit later: CBT, DBT, MDR, stuff like that. Okay, but for the vast majority of therapists, they're going to believe that what you need is either A, prolonged continual exposure to talk therapy sessions, where basically for the most of them, it's going to be kind of indefinite. Like many of them are actually going to think that you need to be in therapy like indefinitely or for the rest of your life. They may not come out and say that, but there is this kind of mode in which therapists are trained where the idea is like ongoing therapy, ongoing coping, right? There's not really many therapists, like I would say less than 2% are out there with the attitude that I have, where they're like, you know what, you can definitely live without anxiety if we take these steps. Let's take these specific steps in this specific period of time, and then we will get the anxiety fully dealt with. Most therapists do not think like that. And if they do think like that, it really goes against the traditional training that they're given. Most therapists can have this view of anxiety of, yep, you got anxiety, here's your diagnosis. This diagnosis is going to be with you probably for the rest of your life. We're going to need to give you coping mechanisms, and your life is going to be about managing this anxiety. It's going to be about, using a series of coping mechanisms, coming to ongoing talk therapy sessions, and or using medication to try to mitigate how things feel. But they don't typically have an attitude that the anxiety is overcomable. It's, and again, let me be very clear. Like, I don't believe that you're going to feel perfect 100% of the time, right? I'm not here to sell you some snake oil, nirvana paradise where there's no negativity in your life whatsoever. I'm a realist. And what I know is that you're going to have some level of anxiety in your life. However, okay, that is not what you heard me just say is not what you think I just said. What a lot of people say is they're like, oh, I know I'm going to have anxiety forever. And what they really mean is they think they're going to have uppercase A anxiety for the rest of their life, right? Panic attacks, anxiety in social situations, anxiety while you're driving, et cetera, right? Whatever your cyclical, ongoing pattern of anxiety is, a lot of people have been taught this either by therapists or looking online or whatever. They just conclude on their own, oh yeah, I'm going to have that anxiety forever. And that, I got to tell you, this is just the God's honest truth. That is not necessarily true. It will be true if you don't learn the right skills and tactics and processes and follow them, regularly, consistently. But you do not have to live a life with perpetual uppercase A anxiety. But you will have a life with some lowercase a anxiety. What does that mean? It means that as you're engaging in the human condition, as you're on planet Earth, as you are living life, as you're growing and expanding, as you're, trying to level up your career and deepen your relationships, and you become a parent, and, all these sorts of things that you end up doing, you're going to naturally grow. And as you grow, you are going to encounter fears and doubts and uncertainties. And those fears and doubts and uncertainties are totally normal and natural when you're going through growth periods. The thing that is unhealthy and unnatural is if you keep having the same fears, the same doubts, the same uncertainties for months and years and decades, okay? It's normal to feel a little anxious when you're learning to drive a car when you're 14, 15, 16, maybe even 17 years old. It's not normal or healthy to be feeling anxiety every single time you drive a car when you're 45, okay? It is normal to feel a little anxiety when you go on your first date, but not when you're 55 years old and you feel anxiety, perpetual debilitating anxiety that keeps you from dating over and over again. Okay, it is normal to feel a little anxious and worrisome and uncertain about your health if you get real legitimate news from your doctor that there's something going wrong. Like some of you know, my wife was diagnosed with breast cancer a couple years ago. That was an anxiety-inducing experience for the two of us because we were in a brand new, uncertain situation. However, we quickly stabilized. We got into a place where we did have general peace of mind and good mental health. We were grading on a curve a little bit, but we weren't, totally fueled with what's going to happen and what if the worst case scenario occurs and is there something else going wrong with your health? Okay, that's not healthy. That's not natural. Okay, so you are going to encounter lowercase a anxiety. I have lowercase a anxiety every once in a while, but I do not have uppercase a anxiety where it lasts and it cycles and it limits my life. Okay, and that's what I want for you, is to live without uppercase a anxiety. Okay, so when therapists believe that uppercase a anxiety is going to probably be permanent and with you for the rest of your life, and so that means like if you have, let's say you have, you break your leg, right, and you are a runner and you want to get back to running, you want to be a marathon runner again, and you get a consultation with 5 different professionals, and one of them tells you, I don't think you're ever going to be able to run again. And the other 4 say, hey, I think you actually will be able to run again, but here's kind of my unique method for making that happen. Chances are you shouldn't go with the person who believes that you're not going to be able to run again if your goal is to be able to run marathons again. And this is what I encounter a lot of times. I will get on the phone with people and I'll ask them like, hey, where are you really trying to get to? What is your ultimate mental health goal? And what they basically describe is a life without uppercase A anxiety, right? They know they're going to have some fears and some doubts, as every normal person does, but they don't want to have limitations on their life because of anxiety. And so then I'll ask them, okay, great, well, what has your history with therapy been like, right? Are you in therapy? What's it been like? And if they tell me, yeah, I'm in therapy, I've been in therapy for, 2+ years or something like that. Honestly, if it's like 6 months or longer, then I ask the next question, which is great. Well, how is it working? Do you feel like the therapy is getting you to that ultimate place that you want to be at without the uppercase A anxiety? And if the answer to that question is yes, then I tell them, great, don't work with me. Don't jump ship and try something else if the therapy is truly getting you to your ultimate mental health goal. Why in the world would we try to fix something if it's not broken? Don't do that. Or sometimes people will say, yeah, you know what? I was in talk therapy. I did it for about 3 or 4 months and man, I felt so much better, but I haven't done it in a really, really long time. And I'll say, great. Well, you only did it for a couple of months. It was making you feel fantastic. And you felt like it was getting you towards that ultimate mental health goal, right? And if they say yes, I'll say, great, go get back with that therapist that you worked with before, because it worked. This is what I'm saying. I am pro whatever works, right? I want you guys to have the mental health you deserve. And I care more about that than getting clients. Like, I would rather you go do what works for your mental health. I want a world without depression and anxiety in it. And I can't do that totally alone. So we need therapists in the world to help the people who are going to respond well to therapy. But we also need people like me in the world who are going to be able to solve the problems that therapists can't solve. Okay? So those are kind of the key questions you want to be asking yourself, right? And number 1, do you believe that you're absolutely gonna, have anxiety for the rest of your life? And by the way, I would challenge you on that and tell you emphatically that's not necessarily true. But if you're committed to that attitude, like if you're not open-minded to that attitude, then I'm not gonna, die on my hill trying to, change your mind. So maybe you should be with a therapist long term, like at least the two of you will look at the same situation and you can just settle for coping. Like if all you're after is coping skills and how to make your life a little bit better with the anxiety still a part of it, great, do the therapy. That's great, that's fantastic. Or if you really want to overcome the anxiety and you think the therapy is leading you to that outcome, fantastic, right? But again, most therapists believe the anxiety is permanent. Most patients and clients are wishing for a moment in time where the anxiety is no longer there. And so there's a fundamental mismatch between what the patient wants and what the therapist believes is possible. And over time, the patient starts to adopt the belief of the therapist that the anxiety is not something that they can get rid of, just simply because, like, after all, you've been in therapy now for a year, 2 years, 3 years, and if the therapist keeps like putting little whispers in your ear, like, yeah, it's going to be a part of your life forever, you're going to believe that, because after all, they're the professional. They got schooling, right? They got an education. They got the degree on the wall. So why wouldn't you believe them? Okay, but it's not the only perspective out there. So you got to figure out, number one, what is your real goal? And number two, how are you committed to looking at the anxiety? Because no problem is solvable when you define it in unsolvable terms. No problem is solvable when you hire a person who doesn't believe the problem is solvable. So you got to be clear on like what you really want. That's a really, really, really important point. Okay. So there we go. And by the way, the reason why therapists believe anxiety is permanent is this idea goes all the way back, basically close to 100 years now, like all the way back to like Sigmund Freud. And the idea of like disorders and subconscious disorders and all that stuff. And don't get me wrong, like your anxiety exists, it's there, like you're not making it up. However, there's kind of two views. The one view is, yep, it's a permanent disorder, it's a part of your brain, you're screwed, you're going to have it for the rest of your life. And then there's how I view it, which is, no, your anxiety is a conditioned pattern or sets of patterns inside your nervous system. It means that your brain is kind of automatically, involuntarily thinking and feeling and behaving a certain way, and we have to rewire that. We have to retrain that process, okay? So that's the number one reason why you may not be getting the anxiety reduction that you want. The rest of these will go a lot quicker. Number two, kind of building on what we just talked about, the second reason you may not be getting the anxiety reduction you want through therapy is because therapy is designed for coping. Therapy is designed for coping. This is a really, really important point you got to understand, I believe anyway. This changed my whole life. Once I really got this, I began my journey to being truly anxiety-free once I figured this out. What I figured out was that the therapist was there to teach me to accept the anxiety, to accept the depression, and to live with it. And to basically make my life as kind of comfortable as possible, given the premise that anxiety and depression were going to be a part of my life, for the rest of my life. I did not believe that. And honestly, part of it was me just kind of being like a cocky teenager, I think. Like, oh, screw that. I'm not going to be like, these people. Like that. I kind of had a bad, not very compassionate attitude about it back then. But I basically was like, you know what? I'm not going to live a life with anxiety and depression. I refuse to. I refuse to ever go back to that mental health hospital. I'm not going to take pills for the rest of my life. I'm flat out not going to do it. I'm going to find another way. And so setting my goal on overcoming the anxiety and the depression was the first big thing that kind of unlocked everything, and realizing, okay, this person's great. They love me. They care about me. This therapist wants the best for me, but there's only so far they can take me. I got to find new information. I got to find new mentors and role models and information. And the therapist was trying to teach me a bunch of coping skills. Like he kept saying things like, well, here's what you can do, to kind of make it a little easier. And I was wanting, what I was craving, what I was desiring is like, tell me the plan to get rid of this shit. That's what I was wanting. That's what I was craving. Like, tell me that. And I even kind of asked him some questions like that, point blank, like, okay, well, how do we get rid of this? And he kept saying, well, you don't get rid of it. You just, but you can do this. You can do breathing exercises. You can meditate. He tried some other simple stuff like that. And I was like, okay, cool, dude. That's your jam. That's not my jam. That's not really what I want to do. I need to figure out a way to solve this. So therapists are trained. They are trained in a model of helping you cope. They are not trained in how to recondition, rewire the brain, or how to overcome and solve the anxiety. If they do get that type of training, it comes from a very, very, very rare set of information and sources around the world where people know how this thing works. And it's not going to come from their traditional education, okay? So let me pause here. I see a good comment coming in from Ethan. Ethan says, the therapist I've been seeing for 2 months likes to focus on moving forward. We are saying right now that many therapists follow what's wrong. He's pushing me to change my life and move forward. Talking about things can keep me stuck in place. He is focusing on helping me find what changes can be made in life, so I'm not just dwelling on the past, but creating new solutions and opportunities. Yeah, okay, that's awesome. Ethan, I love that. I am super glad to hear that. Fantastic. I hope that that's working for you. And by the way, I should have added that as like like number 11 on my list. So I'm going to throw this in here as another bonus thing in relation to Ethan's comment. Another reason why people don't get very far with therapy very often is it tends to focus a lot on the past, most, and then second most, the present, and third most, as in least, the future. So what Ethan is saying is he's actually got a therapist that's doing the opposite, where they're focusing a lot on the future. That's great. And honestly, that would be one of the types of questions, like if you really want to go the therapy route, like ask your therapist before you sign up for like 6 months or 12 months of sessions, like you should interview your therapist. Like, hey, what do you think I need? Like, what is your philosophy of health, of change? What do you think are the goals that are realistic for me? You know, those are the types of questions you want to be asking. So I love that, Ethan, and hopefully you're getting really good results with that. The only other question there would be, are you getting to like the ultimate mental health goal that you want to, and are you getting there as quickly as you want to? Okay, so I'm going to throw that in as a bonus one. Now, a big reason why therapists focus a lot on the past, right, is they want to talk about it, they want to process it, they want to sit with the pain of the past. You know, these are big principles of how therapists are trained to help their patients. And again, I want to reiterate, there is a section of the population where that mode works really, really, really well. There is also a section of therapists, although I've found it to be the minority, not the majority, that are very forward and future looking. So that's a really cool thing. If you find one like that, that's great. Okay, let's go on to number 3. Okay, number 3 here. By the way, if anyone is willing to reiterate these in the comments, like the list of 10, that would be fantastic. I'd really greatly appreciate it. Here we got another comment from Stephanie. First therapist I came across said that your brain, even as an adult, can be rewired. This is true. I may be prone to feel anxious, but I've certainly completely overcome anxiety caused by specific fears in the past. Stephanie, I love that. I am so happy for you, and you've had that experience. I want to say, though, that experience that you have had is probably like less than 5% of the people I have talked to in the past 7 or 8 years consulting with people in this line of work. I am so thrilled. I'm glad you had a therapist with that attitude. That's great. That is just not, unfortunately, how it tends to work out for most people. Anyway, going on to number 3. Okay, another reason why you may not be reducing anxiety as quickly as you want to or as much as you want to with therapy is derived from principles of non-directive therapy. Okay, non-directive therapy. So non-directive therapy is this premise that the therapist is meant not to intervene very directly with the client or the patient. Again, I'm speaking in majorities and generalities here. I'm glad that we've got a couple of people joining here where they've had therapists that are a little bit more proactive, but that is not the typical scenario most people experience. So this goes all the way back again to Freud in the late 19th century. Okay, so basically what he discovered, or his theory, was what he called the talking cure. So what he would literally do is he'd have a patient sit on his couch, and he'd say, "Gotcha, what's bothering you?" And the patient would start to express what's bothering them, and then he'd say, "Okay, tell me more about that." And they would the whole point was for the therapist to pull and pull and pull information and to basically just let the client talk it out. Even if the client would say the same things over and over again, Freud's theory was that would create the processing, that would create the therapy, that would create the relief. And by the way, he was right in 2 accounts. Number 1, immediately there is kind of the honeymoon period a lot of people experience with therapy, typically in the first 90 days. Because, firstly, you do your very first session, and they're listening to you, and maybe you haven't felt listened to in a long while. And so just being listened to very often feels therapeutic. You feel some kind of connection. You feel like you're not being judged. You feel like it's okay for you to feel the things that you're feeling. And that is like a little bit better than what you were feeling before. So it kind of gets you moving in the right direction in a way. You feel that way anyway. And then during those 90 days, you're kind of like, all right, the therapist is getting to know me, but there's got to be a plan. There's going to be a plan that's going to be disclosed, and I'm kind of waiting for the plan, but I'm okay with us taking our time with it. And so a lot of people feel good in those first couple 90 days. They're like, I'm getting help, I'm being listened to, there's going to be a plan, it's all good. Usually by like month 6, however, they're like, why do we keep talking about the same stuff over and over and over again? Why are you not giving me a plan? Why are you not helping me create direction? Why are you not helping giving me structure? Okay, a lot of people will feel like this. And so the thing that becomes challenging there is the therapist is misaligned with what the patient really needs, right? The therapist believes, well, yeah, we're going to just keep talking about it. And you continuing to show up in therapy and talking about it is the therapy. Whereas the patient's like, no, I need to move my life forward. I need a plan. I need structure. I need to get rid of this crap. Okay. So the non-directive therapy becomes a limit. And this was the big reason why I chose to do what I'm doing right now, because I was obsessed with, I got to find a way to overcome my own anxiety and my own depression. And what I found was there's a very small section. Some of them were therapists, but they had radically different ideas than the mainstream. And there was a small section of people that were, kind of calling themselves specialists or mentors or interventionists. And so I just tried to find every single documented case I could find of people who truly overcame anxiety and depression for the long haul. And I wanted to figure out who were the people who were teaching them or guiding them or helping them, and what were they doing. And I found it was an incredibly small minority, because the mainstream basically kind of laughed at those people and were like, what are you talking about? Anxiety can be overcome. Like, no, it can't. And they had kind of been relegated to the outskirts, to the side. And I was like, look, they're the people that have figured this out. Like, they've figured out the golden thread. We need to be learning from them. We need a world where we're teaching everybody how to live a life without anxiety. And what I found was that every single one of those people, they all had their different style and approach, and some I liked better than others. But there were like 5 or 6 like really key methods and mentors that I found where I was like, damn, these people are figuring it out. Every single one of them, though, had one thing in common, which is that they were much more active. They were much more like directive. They were not afraid to give the client instructions. Right, and it doesn't mean like they were bossy. It doesn't mean like the client wasn't able to talk. Of course not, right? Like, these people had incredible compassion, as do I with my clients. Like, of course you need to be heard. Of course we need to like understand how you really feel. But what we don't need to do is keep sitting and stewing in the pain over and over and over again and talking about this crap over and over. Just talking about the pain is sufficient as a strategy for, again, a very small portion of people. And again, not all therapists rely on just that approach, but that is a big dominant attitude and a big dominant style in the therapy community. Okay, so that's a really important thing. And I see Ethan is adding a comment kind of on this point. He says, I have made a lot of progress in such little time. His attitude, meaning his therapist, is solution-focused therapy with some CBT and others. He says it's eclectic and looks for what will work with each individual by mixing different theories. I love that, Ethan. And that is a very kind of similar approach to what I do. So if that's working for you, absolutely great. More power to you. And the key emphasis here, I love what Ethan is saying here. And in fact, Ethan, you're almost helping me teach a little bit better, because I'm going to add in another bonus thing of why therapy sometimes is not sufficient. Is very often therapists are tied to one specific school of thought. So like the CBT people like only want to do CBT. The DBT people only want to do DBT a lot of the time. And it may just be the only thing they're trained in. Not always, right? Some of them are multidisciplinary. But many therapists out there are like, no, this is what you need to do, or this is what you need to do. And I never believed in that either. I believed that we need to draw from the best of all of the different theories. We need to be able to pull from what truly works, and we need to have a level of healthy experimentation with every single individual to make sure that we customize the approach for each individual. So that's a really awesome bonus one too. Ethan says, I'm thinking right now that talking about the same things over and over is like the air in an airplane that just gets circulated, nothing new. Yes, that's a pretty good metaphor to think about it. I can add a little more detail on that here shortly. But excellent comments, Ethan. I love them. Keep them coming. Okay, moving on. So we're on my official list now. We're going back to my official list of number 4. So let's go to number 4. Well, actually, let me say one more thing about number 3, right? So number 3 is that therapy is derived from principles of non-directive therapy. And what is truly therapeutic tends to be proactive. Let me just put it this way, right? Einstein had this really great quote. He said, the level of thinking that got you into the problem will never be sufficient to get you out of the problem, right? And so if you think about what causes anxiety and depression, we could define that in a lot of different ways. But a very simple way to think about it is problems need energy to grow, right? Like trauma, for example. When I help people overcome trauma, don't get me wrong, this is not the only component of it, but one of the things we have to do is we have to get that person from focusing on the past to focusing on the future. We do need to help them process the past, don't get me wrong. Like, we can't just ignore the past and pretend it doesn't exist. We also can't, like, invalidate the victim and say, like, oh, you're not in pain. Like, no, yes, you are. You are in pain, absolutely. But let's help you proactively move into the future. To do that, that requires doing new things, doing different things. And it usually requires some level of structure, some level of direction, some level of leadership, right? You can't get to a new place you've never been by only talking about what you already always talk about. It just doesn't work that way, right? You're never going to get to that future of joy and peace of mind and relief by continuously talking about what pisses you off and irritates you and makes you feel anxious in the present, okay? So anyway, let's keep going. Number four reason why therapy may not be reducing your anxiety enough is most therapists tend to only have three to five core strategies that they revert to. They usually will have a specialty. So the CBT people will call themselves CBT people, DBT people will call themselves that, EMDR, trauma-based people will call themselves trauma-based. And once you get into the therapy, most therapists, again, will typically have like 3 to 5 core strategies that they tend to revert to. And, a lot of times they tend to be fairly basic. They tend to be things like go and meditate, or go and exercise physically, or journal, or, let's try these 2 or 3 CBT techniques. Or, hey, have you tried not resisting the anxiety, just letting it exist? Okay, a lot of you guys have tried that before. And so, again, if you only have 3 to 5 techniques, then you're going to be limited in terms of your ability to affect people. There will be a portion of people that you will be able to help greatly, but it will only be people who are receptive to those 3 to 5 strategies. So for me, and this is not like a flex or a humble brag or any of that bullshit. Like, this is just like the truth, okay? Like, I counted it one time. I went through like the core curriculum that we draw from and the checklist that we use with our clients. And I counted like how many individual strategies do we have kind of in our armory, so to speak. And it was literally 86 direct, unique strategies. Some of them I learned from other people. Many of them we've kind of developed on our own. Many of them I tried on myself and they worked really well. And I want to be clear, like our clients don't have to learn all 86. Usually they only need like 5 or 6. But we have to customize things heavily for each client. We got to make sure that they really get what they need. So if I only had 5 or 6 strategies, I'm not going to be able to help a lot of people, right? Because we have such a vast store of strategies that we can customize plans for. We can make sure that we've got a plan for every different type of nervous system and every different type of anxiety with each type of nervous system that people have. And there's about 20, somewhere like between 20 and 25 of those different variations. We then can customize all sorts of different approaches for those people. So again, just more strategies, the better, typically. All right. Number 5 reason why therapy may not be reducing your anxiety enough is therapy can be helpful for many mental health challenges, but it is not very helpful for others. Now, let me dig into this in more specificity. So here are the types of situations I have found traditional talk therapy to tend to be very, very effective for. First of all, if you are dealing with lowercase a anxiety, like if you are just dealing with a tough time right now, you're going through a little bit of a difficult period, maybe you just got laid off, or you got, some bad health news, or, something along those lines. You really just are feeling like you need someone to talk to. Okay, therapy can tend to be very, very helpful. Short-term grieving, it can be very helpful for short-term grieving. Not long-term, though, like not 6 to 12 months later. People tend to hit a wall with doing therapy for grieving. It can be helpful in a lot of situations with depression, at least easing the depression. Usually not overcoming depression, but if your goal is just to ease the depression, therapy can be helpful in a lot of those situations. It can also be good for anxiety, for some anxiety revolving around expectations that you put on yourself, like perfectionism. Okay, unless it's a really, really extreme case. So kind of in that like mild, general sort of anxiety realm, it can be effective. It doesn't mean it guaranteed will be, it can be. But there are types of anxiety where I have found that the talk therapy model just hits a wall almost every single time. And those are when the anxiety is very, very high, it is very chronic, and especially if it is very localized. So when I say high, it'd be like 7 or 8 out of 10 on a somewhat regular basis. Chronic is in it shows up fairly regularly, at least a couple times a week. And then isolated and specialized, like if you're having panic attacks, anxiety attacks, if you have agoraphobia, if you have a phobia around driving, if you have been, if you haven't gone on a date in 10 years because you've got anxiety about going on a date, things of that nature. Okay, highly elevated anxiety like that, therapy tends to hit a wall every single time. It usually will only be able to help you reduce the anxiety by somewhere between 10 and 20%, maybe, okay? And then they will hit a wall with you, and then they just want to continue to have the ongoing talk therapy. So that's why we get a lot of people who come to us with those types of issues: panic attacks, anxiety attacks, major health anxiety, agoraphobia, trauma-related anxiety that they really just want to get over and overcome, those types of things, okay? I see Joan has a comment. My issue wasn't just anxiety, it was my model of the world, so that's why therapy didn't work for me personally. I had multiple issues, yeah. So Joan's using a phrase that we teach in our client program called the model of the world, which is true. We have to get down to the really deep core of the issue, which again could be another thing on my list here. Therapy tends to only deal with the surface level stuff, not always in the deep, deep level of things, okay? All right, number 6, therapy assumes that you need to be in therapy for a long time indefinitely. I pretty much covered that one already. Number 7, therapists are trained in the diagnostic and prescriptive model, which prioritizes labels and identity shifts. Okay, this one's a little more advanced, but I want you to hang with me on this one for a minute. The best way I can illustrate this is with a story. So I had a client some years ago. She had been having panic attacks for close to 30 years. So they started in her late teens, early 20s. And she was in, I think, her late 40s or 50s by the time I ended up working with her. So she had been through therapy off and on for years, decades even, right? She had been off and on medication for decades. She had, read just about every book she could find. She had meditated. She had tried EMDR, CBT, DBT, all this different stuff. She had tried physical exercise. And, she had periods where it was better and periods where it was worse, but it had always lingered for her. And she wanted to figure out a way to actually overcome the issue. And so the thing that was really key was she had to create a shift. She had to create a shift in her identity to change how she was looking at things. The therapist had basically told her, this is going to be with you for the rest of her life. I came in and told her, you can actually overcome this. When she had been viewing it as, this is going to be a part of my life for the rest of my life, then she was stuck for 30 years. It was only until we introduced a new model where I said, you can actually overcome this, that it became a possibility. Okay. I have to breeze through the last couple because I got to go pick up my dog from the vet. Number 8, you've understandably believed that therapy is your only option. It's not. Lots of different ways to tackle this. Number 9, therapy doesn't help you retrain the brain. It reinforces old patterns. When you start talking about the same garbage over and over and over again, this is where therapy can make things worse. You're actually training your brain to think about the same stuff. It's like getting a cut on the roof of your mouth and then not being able to heal that cut. Okay, and then number 10, therapy will convince you that your anxiety is permanent over time, right? Learned helplessness, which is just not true, okay? So for any of you guys who would like to get a different perspective, I'm gonna offer a completely, totally free half-an-hour coaching session for any one of you guys who's interested in learning a new approach. If you would like that, just go ahead and put session in the comments, and we would absolutely love to support you. But thank you so much for the comments you guys put in. Greatly appreciate the feedback this time, and we'll see you next time. See you guys, bye.